Like most things, pharmacy benefit managers, or PBMs, started out as a good idea. They were supposed to keep prescription premiums down by handling some of the administrative burden for insurance companies. Instead, over the years, they have become complex business entities with immense power, managing the pharmacy benefits for almost all Americans. Yet they are still one of the least regulated sectors of the healthcare system.
Establishing basic registration requirements for pharmacy benefit managers in Pennsylvania will bring oversight and accountability to the prescription claims process that puts patients, pharmacists, and doctors at a disadvantage. PBMs have inserted themselves further and further into healthcare by now stipulating which medications a patient may take, requiring where and when a patient may fill a prescription, and how much pharmacies will be reimbursed for dispensing a medication. Checks and balances are needed, and that's where Pennsylvania comes in.
As PBM's power in the marketplace has grown, their activities have led to many questionable practices. Some questionable practices that may affect patient care include accepting rebates from manufacturers in return for placing higher-priced medications on their formulary, which is the approved list of drugs that patients may take. This may result in higher plan costs and ultimately higher patient costs. Placing drugs on their formulary that provide the PBM with greater margins and then requiring patients to switch to these higher cost medications, sometimes without their knowledge. And finally, selling patient data to pharmaceutical companies for their use in influencing and increasing prescribing habits for certain medications.
As a pharmacist, I'm also deeply troubled by some of the PBM activities which deeply affect my pharmacy and my ability to stay in business and serve my patients. PBMs create a spread between the prices charged to the payer or plan sponsor, such as an employer, and the price they really pay my pharmacy for the medication. Sometimes there is a considerable difference. An example would be when a prescription plan is charged $50 and my pharmacy is paid $25. The PBM pocketed the $25 spread for their own profit, in addition to the many other fees that they're charging, and often without the plan sponsor's knowledge. PBMs also repackage medication to different quantities, generating a whole new price base, and actually helping to facilitate to disguise the spread pricing.
Legislation has been introduced that will require PBMs to register annually with a state agency or department before conducting business in the Commonwealth, and allow the state agency or department to conduct announced or unannounced inspections of a registering PBM.
Oversight of PBMs will benefit both pharmacists and patients alike. If I or one of my patients has an issue with a PBM that needs resolving, there is currently no state agency or department where we can go to get that assistance. With PBMs managing most prescription plans, including those funded by government and taxpayer dollars, oversight of the PBM industry is desperately needed.